Everyone, and welcome to our channel MedStudy. Today in this video we are going to see about examination of thyroid in surgery. So let's get started. First point is general physical examination. Only additional points which have to be examined or which are of importance in a thyroid case are being discussed here, which includes phases, that is thyrotoxic phases, mixed edema phases, pulse, rate and rhythm of the pulse, wet hands or wet sweaty hands. Now coming to inspection. We have to inspect for position and extent of swelling, shape of the swelling, size of the swelling, surface whether it is smooth, irregular, nodular, then margins, then skin over the swelling, any scar and pigmentation, any pulsation, movement of swelling with deglutition, movement of swelling with protrusion of tongue as seen in thyroglossal cyst. Swellings that move with deglutition are thyroid swellings, subhyoid bursitis, prelaryngeal and pretracheal lymph nodes, swelling arising from larynx or trachea. Coming to palpation. We have to palpate for temperature and tenderness, movement of swelling with deglutition, movement of swelling on protrusion of tongue, position and extent of swelling, size and shape of the swelling, surface and margin of the swelling. Then we have to palpate for consistency, whether it is hard, firm, soft and cystic or variegated. Any pulsation or thrill, any skin fixity, mobility, that is side to side and up and down, relation of the swelling with sternocleidomastoid and position of trachea. Now coming to Pizillo's method. It is done in obese patient with short neck. The patient keeps both the hands on occiput and extends the neck, as seen in this image. Now coming to Lahaye's method. To palpate one lobe, push the swelling from opposite side. That is, for palpating left lobe, push the right lobe to left hand and so that it becomes prominent, as seen in this image. Then Crayal's method. Place thumb over the swelling and ask the patient to swallow. Swelling moves up and down and nodularity is felt. Kocher's test. The swelling is pressed slightly on either side of trachea. Stridor is heard if there is laryngomalacia. Berry's sign. It is for malignant infiltration of the carotid sheath. Carotid pulse is not palpable on the side of swelling but palpable below and above the swelling. Now signs of sympathetic trunk palsy, that is Horner's syndrome, includes anhydrosis, meiosis, pseudotosis, loss of ciliospinal reflex and enophthalmos. It can be remembered as ample. Now coming to percussion. A dull note is heard over manubrium sternae. It is seen in retrosternal goiter. Auscultation. We have to auscultate for any bruit, audible or not. Now examination of toxic signs. Toxic signs examination include pulse, tremors in hands and tongue, thrill and bruit over the thyroid, eye signs which includes exophthalmos and lid retraction, Navziger sign, that is look from behind the neck of patient slightly extended. If the eyeball is seen beyond the superior orbital margin, exophthalmos is positive. This image shows Navziger's method. Eye signs include Dalrymple sign, that is visibility of upper sclera due to spasm of upper eyelid. Von Graeff's sign, that is lid lack. Geoffroy's sign, that is loss of wrinkling on forehead on looking up. Stellwag's sign, that is infrequent blinking. Now examination of retrosternal goiter. Lower margin of the swelling, we have to see whether it is visible or not on deglutition. Any dilated veins over the neck and chest wall. Percussion over the manubrium sternae gives dull note. Now Pemberton's sign. When the patient raises arm above the head for 2 to 3 minutes, there happens congestion and puffiness of face with respiratory distress, as seen in this image. So that concludes with the thyroid examination. I hope you liked the video. Please do like, share and subscribe to our channel, and don't forget to press the bell icon. You can contact me through the given email ID. I'll try to reach back to you as soon as possible. Thank you.